Are you or your loved ones at risk for developing Cushing disease or Cushing's syndrome? What is Cushing's? Cushing disease, commonly referred to as Cushing's, is a disease of the adrenal glands. The adrenal glands are responsible for generating corticosteroids. But, with Cushing's, these glands over-secrete these steroids. There are three main causes of Cushing's. One cause of Cushing's is the development of a tumor on the adrenal gland, disrupting the normal feedback mechanisms intended to shut down cortisol production when steroid levels are elevated. Cushing's can also be caused due to small cell carcinoma of the lungs. This disease process causes the lungs to secrete corticotropin-releasing hormone and adrenocorticotropin hormone. The most common form of Cushing's, however, is Cushing's syndrome. This is termed iatrogenic Cushing's, meaning the condition is caused by long-term or high-dose steroid medication use. You might be wondering, what can I expect if I develop Cushing disease? An overproduction of steroids sounds like it might be a great experience. Can I look forward to increased energy and rapid muscle gain? Unfortunately, you will experience quite the opposite. You can look forward to a redistribution of fat resulting in truncal obesity, a moon face, and a buffalo hump. The sustained elevated cortisol levels results in prolonged high blood glucose. This can eventually develop into type 2 diabetes. Other systemic effects include electrolyte imbalance, hypertension, and impaired wound healing, increasing your risk of infection. Due to the effects of excess glucocorticoids on bone metabolism, osteoporosis can develop, leading to an increased risk of fractures. Elevated cortisol can also cause unwanted mood alterations such as irritability, anxiety, and depression. You may experience thinning of the skin, purple striae or stretch marks, acne, or hirsutism. How can you recognize if you have developed Cushing's? Getting your electrolyte levels checked might be the first step. You can also monitor for signs of fluid volume excess, such as peripheral edema, shortness of breath, or crackles in the lungs. Make sure to look for signs that you are developing an infection, such as fever, soreness, or elevated white blood cell count. Treatment may depend on your cause of Cushing's. Partial or complete surgical removal of the adrenal glands, known as an adrenalectomy, may be right for you if your Cushing's is due to an adrenal gland tumor. Tell your doctor if you are experiencing an electrolyte imbalance. A diet change might be right for you. Your doctor may suggest an increase in potassium or sodium restriction. If your Cushing's is due to an excessive amount of steroid medication, the end of your suffering may be near. Discuss discontinuation of your steroids with your provider. If you are currently suffering from Cushing's and would like to prevent fractures due to osteoporosis, discuss increasing your daily calcium and vitamin D intake with your provider. Don't fall victim to increased cortisol levels. Take charge of your adrenal health today.